Thank you very much. You might as well have called us the jet lag panel, I think. And if you're wondering why my accent does not sound Australian, I'm actually Canadian, but I've been in Australia for the past 2 years. One of the traditions from Australia is to acknowledge the land on which we work and play. My land is the traditional territory of the Kaurna people, and I'm very, very grateful to my colleagues in Aboriginal Health who have collaborated on the work that I do today. I also have my disclosures in terms of grant funding. I am also an independent ethics consultant for a number of companies that develop generative AI tools. So first, I'm going to talk a little bit about why I engage youth. This might not be something I have to defend in this particular room, but there are a lot of people who ask me, why do you even bother talking to kids about AI? I'll talk about what their perspectives are from a large survey that we recently completed and how I think this can help us shape a better future for children involving AI. So there's a lot of work on this concept of social license. And social license is the idea of aligning your activities with the values of the people you're trying to serve in a way that goes beyond our specific obligations by law. And so there's been a lot of work describing adult perspectives on these issues. Typically they say, they want faster and more accurate care. They want to learn from more data. They're worried about privacy, loss of human touch, and skills declining. And they agree that they want doctors to stay in charge. But there haven't been a lot of studies involving young people. And so why should we even do this at all? Like I said, a lot of people have asked me that question. One reason is the United Nations Convention on the Rights of the Child, to which nearly all of us are signatories. There's two specific articles there. One is the right of children to have their voices heard in decisions that affect them. And another is the right to get information in the manner that they choose. And so I would argue that when it comes to AI development, testing, and integration, both of those articles are relevant for children and young people. There's many arguments that you can draw from the ethics literature as well. Dominant moral frameworks like best interests out of Canada and to some extent the UK as well, harm standard from the United States, and the zone of parental discretion from Australia are all different ways of thinking about how do we navigate the balance between parental authority and youth autonomy. All of these involve, to some extent, ensuring that we are hearing the child's voice in the context of decision making. They're also irrespective of legal competency. So particularly in other cultures where there's a strong value of shared autonomy or communal values, there's really no way that you can get around the idea of bringing the child's voice into these conversations. So that was why I created this Explain AI for Kids research program, where we really wanted to go directly to kids, understand what kinds of things are they thinking about AI. This was started back in 2017. It was one of my first projects as a postdoc and resulted in a paper that we wrote after interviewing over 30 kids, speaking to them about AI. How do you want us to shape this when I was at SickKids Hospital? So we had a lot of themes that were similar to the adults, a lot of issues around concerns about privacy, concerns about the loss of human touch, and wanting to make sure that people are going to benefit. But what we didn't know was, are these kids just in the hospital? They really had a strong connection with their clinicians. A lot of them had had experiences of having that care. And so we wondered, is this representative of people across Canada? So we initiated this large survey. We initiated it we planned it in 2022. We were nearly done planning it in November of 2022 when ChatGPT was released. And one of the things that I remember was there were kids on our youth council that started asking me about the news articles that were coming out talking about existential risk in AI. Now, hopefully everyone here knows that it's really a bid to get funding. But when you've got the godfather of AI saying that we're all going to be doomed as a species, people are listening. And so the kids on our council were actually asking me about this. And so for that reason, we added some different questions because we really wanted to get at, are people seeing AI differently to other forms of technology that we test in medicine? So digital interventions, more transparent algorithms. Is there something about AI that means that people are looking at this differently than the way they have other technologies? So we wanted to look at this idea of AI exceptionalism. We also wanted to explore some tensions around permissible data uses. So many of us rely on waivers of informed consent for historical health research. There's many other contexts, particularly in North America, where ethics boards will grant a waiver of consent or people don't actually go to an ethics board. So we wanted to know what young people thought about that. We also wanted to know what they think is fair. Fairness means one thing to us as it does to children, and so we wanted to know what they thought about that. We wanted to dive deeper into some of these ideas of trade-offs. If you have to trade off some accuracy for fairness, is that okay? What does fairness look like in the context of different types of algorithms? We also wanted to ask about different levels of automation and data research practices. So one of the techniques that we can use to get at some of this is a mixed methods technique using a contrastive vignette survey. So this is where participants are randomized to one of two arms, where you will see a nearly identical story. Only one of the stories will talk about AI, and the other, in our case, will talk about a new protocol. This allows us to test our group to see, is there really an effective AI or not? We also randomized them on a condition around automation versus augmentation. So one condition where the clinician was allowed to make their own decision, and others where the clinician had to defer to the AI. We did a lot of cognitive pre-testing and survey validation to make sure that we were using gender neutral and ethnicity neutral names. The children also helped us choose the different scenarios. So in some cases, when you want, for example, a harm to happen in the vignette, you want to make sure it's not too harmful, that it's not traumatizing, but you also want it to be impactful enough that it's not going to be nothing. So we were very happy to have a large number of responses that represent the diversity in Canada. This is really representative of the population in Canada, and we went specifically to non-well-represented groups to try and increase representation. So on average, it was about 15 years old, and 87% of them agreed for us to share their data openly as we decided. Now, we had two hypotheses. One was that initially we thought that children would be more permissive with respect to AI technologies. So they'd be more likely to say, yes, I'll participate, or this is going to benefit me. And we also thought that youth would prioritize clinical knowledge over AI accuracy. We were really surprised to find that we found the opposite with respect to our first hypothesis. So young people reported significantly lower trust in AI. And this is one of those questions that we literally added right at the end after the release of ChatGPT. So we were glad we did, because we wouldn't have picked this up. So this idea of AI skepticism came up in a number of ways. We found that there was a higher proportion that would specifically advise against participating in a research study that involved AI compared with a non-AI research study. This happened whether they were advising a peer or a friend in school or a sibling. More youth said that they would decline participating in an AI study if offered the chance, compared with a non-AI study. Now, overall, there was still a strong level of support for AI, so this wasn't huge numbers. But what we were seeing is that among the groups that were concerned, they would talk about things like AI, like these things are coming up, they're coming up fast, but they're still really new and we don't really know the long-term effects. They would talk about this maybe not being the right situation to take a risk. They wanted to know that there were safeguards in place. They also said AI can't care about you the way that a doctor can. No amount of accuracy can overcome that. And among those who did want to participate, they would say the doctor's the guardrail. So you can do all the tech stuff that you want, but really we want a doctor checking this, and we want someone who has a duty of care toward us. We didn't find any evidence of therapeutic misconception, and this is one of the things where we asked them, do you think you'll benefit from participating in the study? Do you think that this is a good thing to do? Do you think we'll learn new information? And we found that people were less likely to say, yes, this intervention will help me when it's an AI tool versus a non-AI tool. So we found that there was still strong endorsement for young people having their data used for health research. This was something they were very much in favor of, primarily out of a motivation that they wanted us to help kids down the line. 38% that said that when it comes specifically to AI, they are more concerned than they are normally about how their health data is used. 36% said they don't feel any differently just because it's AI. And 26% said they're unsure about whether they feel better or worse. What's really interesting about this is that this mimics almost perfectly research out of the Pew Center that's coming about more recently, where we are seeing a minority, but a sizable minority of people who are overall more concerned about AI than they are excited about AI. This number continues to grow. It's been growing over the past few years. And statistically, those of us in academia, those of us in medicine, we are among those who are more likely to be favorable toward AI compared with people outside of a room like this. Now, there is very strong value placed on clinical wisdom. And here I'm talking about wisdom as the idea of knowledge that is grounded in experience, that is grounded in connection. This is following Abiba Burhain in a really fantastic paper in Patterns. This was part of the reason why people would talk about when they were offered the choice, and we had a situation where there was a young child who had come into the ED. They weren't feeling well, and we had an AI-assisted triage tool. We presented the scenario that the child had been waiting for a bit, and after initially being prioritized as not acute, the nurse was starting to notice that the child really didn't seem to be doing that great. And we asked them, what would you want the nurse to do? Would you want them to just override the AI prediction, let them in right away? Would you want them to check with somebody? Would you want them to keep things as they are? As you can see, very, very low support for the idea that the nurse should just follow the AI recommendation. Overwhelmingly, they voted in favor of a nurse and a doctor overriding that prediction. We also looked at different levels of autonomy. So is it, check with authority? Is it automatic insertion into a chart with the clinician being able to override? Is it the clinician determining whether they write something in the chart? And overall, it didn't matter whether the AI tool was supposed to augment or automate diagnostic processes, because they overall had the highest level of comfort when the AI tool provided a recommendation to the doctor and the doctor decided what to do with that. So regardless of these different levels in autonomy that you see, still they looked at the doctor as the guardrail. Very lowest level of comfort for AI going directly into a patient's chart. This was a really nice quote from one of our participants who said, AI only understands ones and zeros, which isn't the best thing in healthcare. It can just see an input, which it will see as a bunch of ones and zeros, and give an output of a bunch of ones and zeros, which your computer translates to be in a way that humans can understand. So it really shows that it's not just about accuracy for kids. It's really about that connection, about knowing you as a person, knowing someone in a holistic sense, by which clinical judgment is exercised. AI and mental health was a particularly tricky territory. We got the widest amount of responses there. And one of the things that we asked about is if you have a patient who received an AI-based recommendation and they followed that recommendation and then there was a failure to respond, so they didn't see any benefit, what is the consequence? What does that matter? And we compared AI versus non-AI. What we found was that when it came to AI, patients were most likely to say, well, just get rid of the AI and you two decide yourselves. When it was a non-AI condition, they said, okay, maybe check it again. Maybe run it again. Maybe it was wrong the first time. Maybe something else happened. So there's an increased tendency to have an immediate blame on an AI tool. Youth also reported that mental health is really this special case where we know a lot less, we have a lot less certainty, and it's more about human relationships. When we asked them about fairness, we looked at the situation of transplant. So transplant is particularly tricky because we have a finite set of resources that we have to make decisions about how we're going to allocate. There's a lot of different ways of conceptualizing fairness within the ethics literature. We went broadly with 3 dominant types. So one is that we are just the most accurate. So whoever's most likely to benefit from a statistical calculation of benefit, they get it. Another is equality, which is all things being equal, we should treat people the same. And then the last is equity. So we should treat first the people who are most likely to need it. And what we found was that people were really split. They looked at all of those and we allowed them to make decisions on each one individually. And so we didn't force them to say, this one's best, this one's worse. And we found that overall there was really this spread. One thing that I think they overall rejected was the idea that it should always only be about accuracy. They recognize that there are situations where we should treat everyone the same, and there are situations where we should treat people with an equity lens first. We asked them, if bias in your model is inevitable, if you can't get rid of it, which does happen sometimes, what should we do with that? We asked them, should it not be used until it works well for everybody? We asked them, should we use it but give a warning to the doctor? Or should we only use it for the patients where it works well? And these are real situations that I've been consulted on as an ethicist. Overall, people really supported the idea of rejecting those two extremes, going with the middle ground where you should use it to benefit those for whom it can benefit, but you should also warn people and make sure that we're not using it out of the context where it works the best. We asked them in your own words to define what makes something fair. So some people said it should not discriminate against people based on something outside of their control. And then other people said it's actually about equity. It's about making sure that each person should be treated as an individual, given the resources that they need to do well. We also asked them the converse, and we asked them of some examples. The top ones that came up, people talked about algorithmic recommendations. They talked about, if you're Googling a picture of a soccer player, overwhelmingly, you're going to get male soccer players. They talked about doing Google searches and not seeing people who look like them. They talked about people getting recommendations based on factors that were about them rather than what they wanted to look at. They talked about seeing stereotypes in media. They talked about biased decisions based on race and gender that they had seen in the news. And they talked about a lack of representation in the training material. So I think youth are really on top of this fairness issue. So one of the questions we asked is, are the kids all right? What's going on, in AI here? Youth are growing up with these technologies from the moment they're born. So I'm kind of in the in-between. I'm like a late millennial. I'm the generation where we didn't really realize the implications of posting our kids' photos on Facebook, for example. And so young people really have this unique knowledge that's centered on their lived experience growing up with these technologies. And so one of the things that we bring in as adults in the room, we have a long-term lens that complements itself well to that tech savviness of youth. And having these open, honest, and non-stigmatizing conversations, I think, will be really important. We've had to engage directly with young people when they say, look, we want you to consent every single patient in this hospital. And we have said we have a human research ethics committee that allows us to use a waiver of consent for the 10 years prior to this. What does that look like? And so navigating those really tricky conversations around some of the practices that we have in health research, we can get additional insights from young people. So AI overall, I think, provokes this particular kind of amazement and distrust. This is what we heard a lot from young people. They saw how good these things worked, and it also freaked them out because it is a bit creepy sometimes. We can admit that, I think. So it might take more effort for us to conduct trustworthy AI research in this context. And we shouldn't mistake the fact that youth are heavy users of the technology for the idea that they trust it and they like it. Some commencement speakers have found this out the hard way. I don't know if folks have followed this, but there's an increasing trend of commencement speakers mentioning AI as the next revolution and getting booed so much that they've actually had to leave the stage. There's also this movement in digital Luddites. So if you go to a phone store, at least in Australia or North America, I'm not sure about here, but you might see advertising for dumb phones. So these are phones without social media capability. There's an increasing number of young people who are rejecting social media. There are increasing trends in privacy-preserving glasses, in clothes that disrupt some of these scanners. And the middle one there is the number one question that I get asked by young people: what about the environment? Sure, you can do all this cool stuff, but what are we doing this for? Are we burning down the planet for doing some of these features? And this is the number one thing that they're worried about, that they ask. And while there is no perfect solution to this, and while each of us may have a limited role, one of the things that we can at least do is start to measure it. And so even in a small way, that's a way that we're trying to meet the needs of young people when integrating AI technologies. So we've got to ask ourselves, what exactly are these kids seeing? I think for many of us, technology has been a way to connect us to each other. If you look at Zoom, WhatsApp, chatbots, all of these things, these have allowed us to connect to other people across the world, where we might not have been able to do that a long time ago. What digital, the kind of new Luddite movement is worried about is that this is getting replaced with this, where instead of using these tools to engage with each other, you've got CEOs telling you, you need a new AI friend. You need to talk to an AI chatbot. You need to have all of these kind of character AI, replica AI, all of these things, rather than this social engagement. This is what people are starting to worry about. And so it's really important that when we are proposing an AI-based solution, we are attending to the fact that people are worried about this kind of future state. So what does this mean? It means that when we're integrating AI, it's got to be the right tool for the right solution. There's many ways that it can benefit, but we shouldn't just do AI for AI's sake. There's different ways to consider the environmental impact. This can include things like comparing different options. That's what we did when we went with an AI scribe company. We said, hey, look, our youth are worried about the environment. What can we tell them based on your product? Some of them basically said, go away. Others actually said, no, you know what? We have an environmental impact policy, and here's some of the things that we do. We can minimize model queries. So some people have kind of come up to me and said, I didn't know about the water usage for every ChatGPT query. So being cognizant of that. It has to be proportionate to the clinical and social value, particularly for the models that have high amounts of queries, high token consumption. And measure and monitor is the best that we can do right now, because we're not always making the decisions at the big tech level, but we can do what we can where we are with what we have. And I think engaging directly with these negative views is going to help us to make sure that as we move forward, we can do that in a trustworthy way. We don't want to be the people coming to present an AI tool and getting booed off the stage. So making sure that we're understanding the context that young people are coming from can help us to do a better job with integration. So with that, I'll say thank you. This was a huge team that put together this survey, and very, very grateful for their efforts.